dissected, and I'll show you under this high resolution microscope. So what we see under the microscope and what you see under the naked eye, which is interesting because this is what you see and this is what I see under the microscope. It's about 20-to-1 magnification, which is amazing. So I always say, can you see what I see? The answer is no, unless you have this training. So I guess really the crux of the talk today is why am I setting out a new venture called Quadratus, which is about stem cells. And it ties into my work at Mayo and my work at Johns Hopkins and my work at Stanford. So I studied surgery for many years, and that's an example, and also the biochemistry with Dr. Cook. And then I wrote a couple books, first of which was Sugar Crush, and that came out in 2015. This explains the connection between sugar and nerve dysfunction. But the only solution we really have or had at that time was surgery. Then I started with stem cells, and actually let me give you a little history of that. Way back, this actually 50 years ago, we used PRP, and I'm sure a lot of people that are looking for a stem cell solution also group PRP, plasma rich protein. You take your blood, you spin it down, you inject. It has good healing qualities, but it's only good for young people. It's somewhat painful because of the cytokines in there, but it does a good job for younger people. People are over age 50, it doesn't work, and it's really not a necessary thing. You've lost 90% of your stem cells by age 50. So what we talk about in Unglued is how to dissolve the effects of sugar. That's what causes this problem. So this is a novel new technique, and that's called stem cells. And that's why I formed this new company called Quadratus. And Quadratus stem cell clinics are going to bring that technology to the public in multiple locations with multiple different doctors assessing the damage your body has accumulated over time and introducing this new technology, which is called stem cells. And I know you have a lot of questions you want to ask me about stem cells and what they are and where we get them and all that sort of thing.
Yes. Okay, so one of the questions that's mostly asked by patients is, what are stem cells?
Yes, and I get that question every day, and I modify that question. What are they? Well, there was a fellow by the name of Arnold Kaplan, and he named them years ago, 20, 30 years ago, and he called them mesenchymal stem cells, MSCs. But then after looking at a lot of scientists came into this space, what are these things? How do they work? And what should they really be called? He renamed them in 2017. He called them medicinal signaling cells, which is using that acronym MSCs. So when you hear that word MSCs, stem cells, that's synonymous with medicinal signaling cells. Now, if you really ask me in 2015, back then, I would probably say the same thing, but this is 2025. They're not stem cells. Even though the government calls them that, that's not what they are. Your body has stem cells. This material, and we'll get into what they are and where we get them from and how they work. But before I name that sort of thing, what other questions you have about where we get them, the types of stem cells, etc.?
So I also have patients asking, how many cells do I need?
Get that question every day, and it's an excellent question because everybody's different. And I'll use this term throughout, itis. We call all these things that happen in our bodies. For instance, we use Greek and Latin to describe these things. And this goes back hundreds of years when there were so many different languages. The elite spoke Latin and Greek. So the populace spoke all these other languages, didn't know what they were talking about, basically. So they could communicate. So let's take anatomy. So a joint in Latin is arthro, and arthritis is inflammation of a joint. So when you say to me, or I say to you, as a patient, I said, "Oh, doctor, my hand hurts, this knuckle hurts," and you say to me, arthritis, all you're really doing is repeating to me what I just said to you in another language. And that goes for MS, autism, Alzheimer's, doesn't matter. That's the nomenclature, the naming of diseases. But really, what is happening? It's inflammation. And we'll get into the weeds on how stem cells resolve that.
Okay, Dr. Jacoby. So I have also a question here. It says, will the DNA from stem cells mix with mine?
And the answer is no. So let's go to source. Now, I'll give you a couple part answer to that question. So embryonic stem cell, that may be true. We don't use embryonic stem cells. So what are embryos? That's the gestational product, obviously, of a fetus. And George Bush in 2000 said no use of embryonic stem cells to be allowed or used unless you're in a university setting, and we don't use that. So we use non-embryonic stem cells. So what are they? Here's the mom. There's a cord between them, the umbilical cord, and we have the fetus. Once that fetus is cut, then we call it a baby. That's the legal definition. So we're using the supportive tissue around that cord, umbilical cord, which is called Wharton's jelly, named after a guy from England in the 1600s. Well, what is it? What's in there? Are they stem cells? Technically, yes, I guess so, but they're not really the mechanism of action. They provide all the nutrients and growth factors to create that baby end product of that process. So that's what we use. We use Wharton's jelly. So there's what's called immunologically privileged cells, to answer the question. Think about it. The baby, actually, the fetus is a foreign body. Like you had a splinter, the body's going to reject it. But it has to have a tether, a cord between it to protect the baby from the mother and the mother from the baby. And that's how this magical formula works out. So the answer is they're immunologically neutral cells that do not interact with your cells.
Okay, doctor. There's someone else asking, how long does it take to see results?
Good question as well, and it varies. It depends on age, amount of cells, what conditions you're treating. And I think, I'm a big proponent of this, the metabolic makeup of the patient. And what I mean by that, if you have a patient who is a diabetic, which most of us are in the United States, or metabolically, we call metabolic syndrome, 93% of all the people in the United States have a problem with sugar. They don't know it, but they manifested all these different itises. That's the direct cause. So as a rule of thumb, the worse your diet is, the bigger the dose you're going to need, and the longer it's going to take to resolve your problem. The better you treat your body, especially after you get the stem cells, and I'll use the same word, stem cells, and the better you're going to do, and the longer it's going to last. So diet is important, movement, getting out and about, vitamin D, natural sunlight, red light therapy, which we also use. So we use a multifaceted approach, not just stem cells, and I'm using that generically, because we use exosomes, and we'll get into exosomes, because they're the nanoparticles of these stem cells.
Okay, Dr. Jacoby. Do I need a MRI or X-ray before the treatment?
Not necessarily, but it's a good idea. So let's say you're from out of town, which we see a lot of patients from out of town. So let's say you live in Colorado and you had an X-ray and an MRI of whatever particular part of the body, let's say the ankle, for instance, and you have an MRI and an X-ray that says that you need surgery. So I would like to look at those results, and I can tell from the inspection of the X-ray and the MRI or an ultrasound, whatever you might have, and I can give you a better idea, or a couple of things. Number one, do I think that these stem cells will help you, or are you just wasting your money? Because some people, I just tell them it's really not going to help. You need to do the surgery. But I'd say about 80% of the patients, even though your doctor may have said that's the only option, it's not the only option. So you have medicine, aspirin, whatever, pain pills, injections, cortisone, surgery, but there's another option in between. It's called stem cells. So I can assess those MRIs and X-rays, and if you don't have them, we can get them when you come down to see us at the clinic, or I can order them in your hometown, so it's more efficient. So there's no sense traveling, coming down to see me, and I say, I don't think it's going to help you. So yes, good question.
Okay, so I have a follow-up question to that question. Why doesn't the public know about stem cells?
Well, I'm doing the best I can. That's why we opened the clinic, Quadratus stem cell clinics, because we want to focus directly on that, not the medical portion of it. I did that for 50 years in surgery. Not that it's not necessary. It's just this technology is new, or at least it's new to the public. It's interesting. The Senate hearing with the senator from Arizona, John McCain, convened a non-embryonic stem cell symposium in 2003. What did the senator say? The answer was, it's a miracle. Well, it's a miracle that the public doesn't know about this. We certainly know about the other day that acetaminophen Tylenol might be dangerous for autistic kids. But at the same conference, why didn't they tell us that autism is being treated every day, especially in Dr. Reardon's clinic in Panama? So we might want to talk about that. Why aren't stem cells better known? And who's hiding it? I guess this is the real question.
Okay, so I also have this question. Why is the procedure not covered by insurance?
That's a good question. So it goes back to research, and it goes back to our system of medicine in the United States. Medicare, insurance companies, the research from the universities, they're all pro pharmaceuticals because they don't solve the problem. And that's another important distinction here. And I have to be careful. We're not saying the word cure, but we are saying, I'll just use a metaphor. Inflammation really comes from a Latin word meaning flame. It's on fire. Stem cells put the fire out, whatever you want to call the fire. Medicine mitigates, slows the fire down to a controllable low flame, never fixing it, but does give you relief, like aspirin or Tylenol. But they have so many side effects, they will kill you from some other drug. So stem cells in all its iterations, no matter what you want to call them, have a profound effect on dampening down the inflammation.
Okay, perfect. May I ask, why do people go out of the country to get stem cells?
I think they like the country, going on vacation. No, I'm kidding you. Well, the reason is, and that's a good question, because now let's go back 25 years ago. And this is an interesting story because Dr. Neil Reardon, who is from Scottsdale, in 2000, when Bush said no stem cells. Now he's a PhD. He's not a medical doctor, he's a PhD. So he was working on stem cells, and he saw the opportunity to do non-embryonic stem cells, Wharton's jelly. And he went to Panama, where the laws are different, set up its clinic, was made famous with Mel Gibson on Joe Rogan podcast And I know Dr. Reardon personally had 2 million hits that made him world famous. And people said, "Oh my God, they use the word cure. It's not that we can't use that word cure." But they flocked to Panama this 25 years ago. The clinic is absolutely gorgeous. Panama is a beautiful country. And if you want to travel to a nice country, that's a great country to travel for stem cells. But you don't have to. You don't have to. And the rich and famous did and still do. Or you can go to Mexico. They have some great clinics. Shout out to Josh at Dreambody Clinic in Puerto Vallarta. But if you want stem cells, you can do them right here. But we are under much stricter guidelines than they are. Number one, we cannot make any claims. I cannot tell you these cure anything, even arthritis. I can't tell you that it is without side effects when I don't absolutely know that. I only have about a 50-year experience that they are not. Let's put it this way, dude. Stem cells have less side effects than patented FDA-approved medicine. Absolutely. There's no comparison. So that's probably the bigger threat. They do work. But I can't tell you in the literature in a double-blind study because that hasn't been done. So let's get into the weeds on doses, sources of where we get this. What do they do in Panama that's different than here? And I think the answer is they do the same thing. Now, Dr. Reardon does have a beautiful clinic. He grows and expands these cells. And in his theory, I think he uses the word, he picks the golden cells out of the batch, like let's say it's chicken soup, okay? And he's picking out imperfections in the tomatoes, of whatever metaphor you want to use. Is that a better broth than what we get here? That's debatable. I don't think so. They're all the same. They're Wharton jelly, they're expanded, they're frozen, and they're injected in all different ways. So, yes, go to Panama, beautiful place. Costs are significantly higher there than they are here, but both are good options.
Okay, Dr. Jacoby, may I ask? I've heard using stem cells in the United States was illegal. How are you able to use them?
Well, the word illegal is the question. There's such a cloud on all this stuff from the FDA. This gets very, very detailed. So the FDA 2 years ago came out, 2023, and we've been using it, by the way. I've been using it for 20 years. And all of a sudden, the FDA said, well, maybe these are drugs. Now, if they're drugs, and Lucy was our first primate 3.2 million years ago, then I guess Lucy was a drug dealer, or is a drug dealer, and every woman who's pregnant is a mule. I guess you're subject to be arrested because they're carrying Wharton's jelly. It is not a drug. But the FDA says it is. So they concocted some science and legal jargon to protect the public from big pharma. No, excuse me, they protect the public from bad operators. Well, maybe it's true. What I mean by that is they said Wharton's jelly, and they're saying they're stem cells. I wouldn't agree with that, but we'll go with that definition. They have to be homologous use. Now, everybody knows what that word is, right? No, they don't. And nor do I think the FDA understands that. So homologous use means like for like. So if you took Wharton's jelly, the covering, and injected into the wrist, that's not homologous, not the same. This is a covering, a supportive tissue, and I'm putting it in a joint. No, that's not homologous. So where could you put it? According to their definition, you can't put it anywhere unless it's homologous. But my definition, which I use, is called Dorland's Medical Dictionary. I don't know what dictionary they used, but Dorland says a like function with a somewhat different outcome. Like the arm is homologous to the leg. A little bit different function, but very essentially the same. So I say the fetus, which is developed by the Wharton's jelly, is really a duplicate of the mother. So by that definition, it's homologous. So it's Wharton's jelly. Let's really define that. The umbilical cord is made up of artery, nerve, vein, and a lot of people don't realize there is a nerve in there. It doesn't have any pain receptors. That's why you can cut it and it doesn't hurt, but it does to communicate with the mother and the fetus. So it's sending all this information to the fetus to grow. If that is not a neurovascular bundle, then the FDA's use of the word has been misused because it is a neurovascular bundle. This is a neurovascular bundle, and every end organ in your body has to be fed by a neurovascular bundle, like carpal tunnel. So my definition is correct and my interpretation is correct, but there's a lot of controversy about that. So is it illegal or illegal? Well, there's many clinics doing on what I'm saying. FDA is not doing anything about it because they know that we're really following the law, that they kind of messed up, so to speak. The other criteria is you can't manipulate the cells, and we don't. We get them from an FDA lab. I can't tell you they're curative because I don't have those double-blind studies. And I can't have a systemic effect, as they say. That's the rules. It's called 361. If you're not in a 361, you're in a 351. That means it's a new drug application, and it costs you about $200 million, and you can do the studies. And that means Big Pharma would own that. Right now, we can do it here. Now, a corollary to what we can use and how can we use those products. So in my clinic, I address the neurovascular bundle. If you have a problem with like tarsal tunnel, which is a diabetic-related problem for the most part, I'm going to put it right next to the neurovascular bundle, homologous use. Now we'll get into mechanism of action because they're really not stem cells. They're growing new blood vessels. That's what they do, and they're called pericytes. You have to really read my book to understand all the details on that, or listen to my podcast. But the bottom line is they're very simple molecules that produce profound effects, beneficial effects on just about every inflammatory disease in the body. So I thank Dr. Reardon, who is from Scottsdale, pioneer in Panama, and if you got the money, hop on your private jet and fly down there. It's a wonderful experience, but we can do it right here in Scottsdale.
Okay, Dr. Jacoby. What message would you like to give your audience?
Number one, don't eat the poison. That's sugar, right? Because that's in baby formula right on through our entire diet. That causes the inflammation, that causes the fibrosis, and that's what we put all these labels on, from carpal tunnel, tarsal tunnel, ulnar tunnel, MS, autism, Alzheimer's. They're all itises caused by that same problem. If you're considering, let's start from the basics. You change your diet, which I recommend, keto or carnivore, at least for a week or two, to see if your inflammatory bowel or whatever is causing your problems starts to mitigate, and you're on a lot of drugs and they're not really working, stem cells are a good option. Or if you're facing surgery of any type, and I don't want to get into the specifics of what type of surgery, but we're talking orthopedic surgery, joint surgery, and you either don't want that surgery, or you can't afford that surgery, or you don't want to take that risk, there is an alternative. That's where the MRIs and X-rays come in, and an exam to see if you're a candidate for this. So that's what I would suggest.
Perfect. Thank you. Do you have any other questions that people ask you most frequently?
And The most common question I get when in a general conversation, when I was playing pickleball today, just to give you an idea. Oh, I have my Quadratus stem cell shirt on.
Beautiful.
I thought it was nice orange. Kind of matches the rat there, doesn't it? Well, and the gal, she said to me, what do you do? I said, I have a stem cell clinic. Oh, and I could tell the tone of the oh was, you're killing babies. No, I'm not. That's what the myth is out there. And is it done around the world? Yes, it is done around the world, not in the United States. I know that Ukraine, in Kiev, there was their main sources, embryonic stem cells, taking a fetus, taking those cells and injecting for the same purpose we use the non-embryonic. There's a real fundamental difference. So let me just nuance that for you for a second. Embryonic stem cells, fetuses, first of all, you're growing a fetus to extract those cells. Ethically, that is got a lot of problems. Or you're taking an aborted fetus and using them as well, equally a problem. But there's a medical problem because there's a gene called P38, which means you could harbor that in an embryonic cell and you could have an aberrant metastasis like a cancer. And I noticed on the FDA, ooh, be careful, there's cancer. And they're right, but not embryonic. They don't make the distinction. And that's what this person was saying. Oh, this is dangerous. No, it's not. It's dangerous not to explore this. Remember what Senator McCain said in 2003. It's a miracle. And it's a miracle we're not using it every day. And it's a miracle that why is insurance paying for it? Good question. Ask your senator. I can't answer that question.
Okay. Is there anything else that you would like to add? Any other questions that patients ask you?
Oh, number one is what's the dose? I can't answer that, and so I see you make the exam, look at your MRI. The other question is how fast will this work? That's a big thing. I don't know, but I can give you examples. I'm giving myself as an example because I did my back. I was scheduled for surgery. That was about 10 years ago. Did everything that everybody else does, epidurals, injections. Now I'm scheduled for surgery. I said, let's do stem cells. Oh, there's not enough literature, my neurosurgeon said. Well, he's correct. I said, well, I'm going to do it anyway. So I did the stem cell injection, the same thing I'm just talking to you about. And within 3 to 4 days, I was back playing tennis. Does it work? Work for me. How many shots did I have? 1. How long did it last? 10 years. That's me. I did my own shoulder rotator cuff, very common problem. That's 5 years ago. 1 shot. No, it's more than 5 now. So I've done it several times for myself. So there's a range, but my diet's pretty good. So I think I respond better. But most of my patients do not have good diets. They're going to have a bigger dose. They're probably going to pay more money because they need a bigger dose. So in closing, here's what I say. Think of it as like I'm a fireman. I'm coming to put the fire out. And you're in the back room with gasoline, sugar, and I got the foam. I'm throwing foam on the fire and you're throwing gasoline on the fire. You're not going to get as good a result as somebody who doesn't put gasoline on the fire. They're all good questions, though. And at Quadratus stem cell clinics, I will help you make that decision if I can. So it's qstemcells.com. And the phone number is 480-841-5185.
Okay, Dr. Jacoby. The last thing, can you show me your books once again? And then where can we find your books?
Probably the most common place is Amazon. And also Barnes & Noble. And then there's a whole bunch of private bookstores that sell this book. This is my most recent book. This book came out in 2015. My Mayo clinic work, it's embarrassing, is 2011. Been doing this a long time. And my new book, which is called The Terminal Zone, will be out first quarter of 26. And that will be available on Barnes & Noble and Amazon. But this new book will answer a lot of the questions you just asked, by the way. So I go really deep into the chemistry and the biochemistry of disease. And I use the term I call the estuary effect. There's about 400 estuaries throughout the body. That's where I believe these diseases start. I have a very complicated theory, but I think I've explained it simply. And we're going to talk about cancer as well, because this is a bigger problem than having a sore ankle. And also, I think we need to solve this autism problem. 1 in 12 boys now in California. That's a national disgrace, and it's real. And Tylenol is not the answer. Stem cells are.
Okay, thank you, Dr. Jacoby. So I just want to tell the audience that we'll be live every Thursday at 1. They could always send their questions. You'll answer their questions. Send them either once you're live. They could send it to your messages. We'll add them in here and ask you. Okay. Is there anything else that you want to say, Dr. Jacoby?
I thought you did a great job. You're a professional, aren't you?
Okay, perfect. Thank you.